Well, doctors, including Anthony Fauci and Dr. Collins from the National Institutes of Health, say it was too early for this emergency authorization. Can you tell us what the situation is here?
Well, I mean, a lot of doctors, a lot of practitioners in the medical community, they are concerned, and for good reason. The deal is, we medical doctors, we rely on what's called fact-based evidence. And basically what that means is we need as many facts as possible. And with the emergency use authorization, we're going to be forced to use this medicine, which is good because the medicine has shown a 35% reduction in the mortality rate. So the medicine is helping people, but still there are a lot of things that we don't know. Like, for instance, when is the best time to prescribe the treatment for a patient? When is the best time to collect the blood from the recovering patient? There are a lot of things that are not fully defined yet, but now we're gonna, start using this medicine, and we just want to make sure that we're doing what's best for our patients.
Dr. Quinn, how does this plasma, how does this work? Is this like an infusion? Is it a shot? I think it wouldn't be a pill, but I'm not a doctor. That's why I'm asking you.
Well, basically what happens is when an individual gets coronavirus and they recover, these are people that are strong enough to produce the antibodies in their blood. Their immune system works really well. They produce these antibodies and they fight it off and they win the fight. Well, these individuals, they've demonstrated that their immune system can win. So what happens is we take blood from this person and we take out the plasma, which is the part of the blood that doesn't have the red blood cells, but it does have the antibodies. And then we infuse it into someone that's actively infected with the coronavirus. And basically what that does is it introduces these antibodies that have proven to work for the person that already recovered. Now this person can fight just as well as someone else. And in a lot of cases, these are people that are very sick. As I said before now, even though we're a little skeptical, we still have to recognize, and the FDA did say that there's a 35% reduction in the mortality rate. So that means if a person gets this treatment, they're 35% less likely to lose their life. So it's a good thing. It's just the medical community is a little bit skeptical, but at the same time, this is a unusual time in history where we just have to really just go above and beyond. So we have to be optimistic about it, but we still are just a little bit skeptical for the reasons I stated earlier.
Yeah. Mm-hmm. So how would this plasma be helpful to the COVID-19 patients?
Well, as I said before, basically, if you have someone that contracts COVID-19, especially those that are very ill, those that are in the ICU on ventilators, in a lot of cases, these might be elderly or people with chronic medical conditions. They may be slightly immunocompromised. Maybe their immune systems aren't as strong. Maybe they can't produce the antibodies at a fast enough rate to save their life. But by getting this plasma has the antibodies. So now they don't have to produce the antibodies because they're getting the antibodies. And these are antibodies, remember, of individuals who contracted COVID-19, developed the antibodies and fought it off and won the fight. Now we're giving those people that are vulnerable these same weapons that have already worked. So it's really a good time, and I don't want to make it seem like we're so skeptical we're not going to do it, because we're just jumping up and down. We're having a party of happiness, but at the same time, we just really wanted more data. But because of the situation, we have to move forward and we have to save lives.
Mm-hmm.
Well, it's another weapon in the arsenal anyway. Thank you, Dr.
For a
Quinn.
new virus.
Yeah.
All right. Thank you, Dr. Quinn.
Hey, we got to take a break.